Welcome to Myofunctional Therapy for Healthcare Professionals, a self-guided course. Myofunctional therapy has a scientific and official definition that is intricate and overly complicated, but that is not what you are here for, and that is not what this course will involve. I want you to leave this course with a basic understanding of what myofunctional therapy is, what it can do for your business and patient relationships, and knowledge of what to look for before you refer. In the simplest context, you can think of myofunctional therapy as being similar to having a personal trainer for all the muscles below the eyes but above the shoulders. These muscles all work together in various groups when we are breathing, chewing, and swallowing. A myofunctional therapist works with the patient by teaching them various exercises that strengthen these muscles and train them to work properly, which is essential because when we see dysfunction or we see there's an airway issue or a narrow arch and palate that's high and vaulted or a tongue that's thrusting or tethered, we know that there will be subsequent problems with sleep, speech, eating, or breathing. Some or all of those may manifest. In myofunctional therapy, exercises go from isolating and strengthening the muscles to proper coordination and daily life integration. When patients complete the program, they should have established the three goals of myofunctional therapy: tongue up, lips closed, breathing through the nose. Programs are personalized and vary from provider to provider, as a myofunctional therapist can be a hygienist, a speech-language pathologist, a physical therapist, or occupational therapist. Some programs will also incorporate various disciplinary accompaniments. However, you can also investigate these common incorporations: buteyko breathing and restorative breathing. Our myofunctional therapy program utilizes restorative breathing, voice gym, breathwork, and Reiki. Restorative breathing aims to achieve proper cranial nerve function, sensory integration, and nasal breathing. Voice gym utilizes the voice and primitive movements to establish proper tongue posture, diaphragmatic engagement, and pelvic floor stability. Breathwork engages the user in conscious breathing and teaches control over the breath. Reiki uses ancient energy methodology and meditation to restore health and wellness. Each has much success on its own, but we find our myofunctional therapy program to be not only dynamic, but complete with these accompaniments. Buteyko breathing, as a series of exercises to facilitate nasal breathing, is a worthy accompaniment to any myofunctional therapy program. However, it is also very common and freely accessible. You can immediately get your patients access to buteyko breathing exercises via books, DVD courses, online courses, or numerous providers. Some buteyko exercises are similar to exercises within breathwork and restorative breathing. Therefore, we do not teach or utilize buteyko methods, but upon your own investigation, you may find it useful and seek it out when deciding on a myofunctional therapist to work with. Adapting myofunctional therapy into your practice. Why? Your practice can achieve far more as a whole patient practice than it can as a limited evaluation and treatment office. In this day and age, we are fast-paced and eager for quick results with limited investment. That investment can be monetary, but even more valuable is time. No matter where you are in your life or career, there is nothing more precious to you than your time. You want to be able to freely enjoy time alone or with friends or family when you're not committed to work or outside obligations. I know that when I take my kids to the pediatrician, I know exactly what to expect. I get the same round of questions and she checks the same areas consistently and without fail. Many people feel that same way about the dental office. Consider for a moment the idea of presenting your patients with something new and unexpected. A hesitation may occur due to fear of patient acceptance, but all things are easily digested when presented correctly. A small background on myself can easily lead into a great case study. I am a mother of 4 wonderful children. Each one is unique, and yet they are very similar. Winters would be a revolving door at the pediatrician, and it killed me having to go to the same prescriptions every time for each child, one after the other. Ear infections, throat infections, colds, fevers. It keeps coming. And as a parent, you feel helpless. You blame other children at the school or the daycare. You may even blame your own child for not washing their hands properly or dressing warmly. You complain to other parents who have the same problem. I mean, we've all been there, right? None of it solves that issue, though. It just bandages it and allows you to accept it as just a way of life. Beyond the obvious, there are sometimes other secrets we keep as parents. Things our children do that we find embarrassing and we do not wish to share with others. Like the fact that my oldest daughter wore a diaper to bed until she was 10. She also sucked her thumb and had night terrors. The next two younger girls had constant ear and throat infections, and one was very sensitive to touch and an extremely picky eater. My oldest child and only son has ADHD, terrible fits of rage, and was a terrible sleeper. He would be up all day and drop like a brick around 7:30, only to be heard playing in his room at 4:35 in the morning. The few times that I brought up any of these things to the pediatrician, she wrote it off as something they would just grow out of. The ADHD that teachers had suspected since he was in kindergarten was not referred to a specialist for diagnosis until he was in sixth grade. I often wondered if life was this stressful for all parents. Do we all have to keep these kinds of secrets and have our children just grow out of all their problems? Well, I changed dental offices, and for the first time, I took them to see a pediatric dentist. She asked me questions about how they slept, ate, and behaved in school. It was refreshing to be asked and not to prompt the conversation with the doctor. I responded honestly and openly. I needed my problems to be heard on a safe sounding board, while at the same time having my curiosity fulfilled with how these things were even related to dentistry. After all, I am a dental hygienist and I had no idea of the connection. Well, the answer was all in the airway. That's right, the ADHD, the thumb sucking, the ear and throat infections, the sleep problems, the snoring, grinding, anxiety, temperament, malocclusion, all of it related to the way they breathe and the resulting narrow airways that developed. I won't bore you too much with the details yet, but as a parent, I was thrilled. Finally, an answer and from an unexpected source. I can't begin to tell you how grateful I am for that day of discovery. We made many changes in our home and life, and things have been drastically different in a positive way. I am forever connected to that dentist and her office. I refer all my friends and family, and I posted glowing reviews online. Beyond that, people see the change and ask how I went a whole winter without going to the pediatrician. Now, back to our original conversation about saving time. I could have spent lot of time going to the pediatrician and various specialists to get to the root cause or to find various things that could help alleviate these things for my children. But this dentist saved me precious time by providing me with an answer that I got when I wasn't expecting it. Now, I know you're thinking right now, why is myofunctional therapy the magical answer to these dental and airway problems? And let me let you know right now, like if that is the leading question on your mind at this point, let me just burst your bubble in advance and address your concerns. Myofunctional therapy is not magical. It honestly lacks enough complexity to be its own official profession. It is a interdisciplinary adjunctive treatment. There are appliances, surgeries, and treatment that it accompanies and it helps to improve the results of. However, the beauty of myofunctional therapy lies in attaining the three goals, which we discussed earlier: keeping the tongue up, the lips closed, and breathing through the nose. The therapy restores a normal and natural function to the body, and when started early enough, can dramatically impact dental arch formation, facial development, and airway patency. You see, having a positive impact and a solution to your patient's problems as a whole will always put you ahead of the competition. There are many dentists that can do amazing things with teeth, but how many stand out as providers or as whole body caregivers? And that's exactly the path you take when you start to give patients answers to their trouble. You become their standout provider. Adapting myofunctional therapy into your practice. How? Implementing an airway focused practice can be challenging at first. I recommend starting out by getting as much additional information as possible prior to changing evaluation procedures. Start with reading some books by leaders in the field. Then take your search to the internet and read peer reviewed research articles and journal publications regarding orthotropics, myofunctional therapy, tethered oral tissues, ADHD, and sleep apnea, among other topics you will discover as you search. Follow the leaders in the field online on your social media. They post research articles, presentations, blog posts, podcasts, many things that can keep you continually updated. Look into continuing education courses online and in your area. There is a constant push to inform others about the field, and courses are becoming more and more frequent. Or you can join an association if you so desire, because that will also help to keep you informed. After your research, you want to immediately seek out a team. Your team is not only a referral network, but a sounding board to implementing whole body patient care. This is a list of team members, but for the purpose of this lecture, I will focus on the myofunctional therapist. Ideally, you want to select more than one myofunctional therapist for your team. People like choices, and honestly, not all personalities get along well. If you have few options in your area, as a dentist, you may elect to send your hygienist for training. Or you can choose an online practice like ours, which serves the nation in addition to the region to offer care in the interim. Reach out to many myofunctional therapists and ask to meet with them. Inquire about the services they offer and their pricing. You know your demographic and the amount of disposable income available for them to spend on healthcare. See if your pricing and their pricing align well. Remember that your team reflects on you, and you want to ensure that the people you refer to will offer your patients a quality experience. The next step is to determine your role on the team. As a dentist, you can elect to perform frenectomies, use orthotropic appliances, offer sleep appliances, or simply just be the doctor who refers out. As a pediatrician, you can offer referrals to others on the airway team and inform parents of harmful habits. As an ENT, you can evaluate and treat soft tissues of the airway and refer when needed to a dentist for appliances to expand the arch, bringing forward the mandible and increasing the airway when applicable without surgery. There are various roles that each healthcare provider can take on. How exactly do you fit into the team? Adapting myofunctional therapy into your practice. What to do? My most important thing I want you to take away from this is to start slow. First, you just basically want to incorporate new medical history questions into your common questioning. You want to inform patients that all the answers they're giving, you're going to monitor the progress and the development of. When you see them at their next recall or recare visit, you just want to double check, see if anything has gotten better or worse. And you're only going to refer out initially the severe or very obvious cases. When you're looking in your medical history for questions to implement, you want to start asking questions about how they sleep. Are they snoring at night? Any grinding? Was their bedwetting past age 6? Any prolonged thumb sucking or pacifier usage? Was there a difficult birth or trouble nursing or latching? Was there any history of ADHD, um, picky eating, difficulty chewing hard foods, any asthma, eczema, Frequent congestion, these things are all related. And as you begin to do your research, you'll see how it all fits together. But a basic starting point, definitely ask about the history of sleeping first and foremost. When you're looking physically at the patient, you want to look for a tongue thrust. Are you seeing their tongue as they're speaking to you? Do they have narrow dental arches with a high palate, crowding of the teeth, or malocclusion? Do they have the allergic shiners right below the eyes? Flaccid cheeks or flaccid lower lips? Frequent lip biting or Cupid's bow? Tongue and or lip tie? Or an overdeveloped mentalis muscle? These things all implemented together, once you start looking for the patients that you're going to refer out, you find that when they come back to you after starting the myofunctional therapy or after doing the research themselves, that you really began to impact not only where they are now, but their trajectory, their health in the future as well. You may be preventing them from having problems or from prolonged problems. And you really discover that you can make a difference by adapting myofunctional therapy and just becoming an airway centered provider, a whole body provider. You're making a profound decision, and it really shows what kind of provider you are and that you're ready and willing and capable of impacting the lives of your patients in a truly outstanding way. If you find that you have any questions, please feel free to reach out to me at any point in time. You can always contact me through my website. It's www.themyospot.com. I look forward to hearing from you. Keep me updated on your journey or any struggles you have. I'm more than willing to consult with you and have a free 15-minute conversation, and we can talk and work through all your issues. Thank you so much for participating in this course. Please look at all the resources that are attached to this course. Hopefully those help you as well.